Assalamu alaikum and good evening, my dear students. আজকে আমি যেটা আলোচনা করব সেটা ENT OSPE আমরা শুরু করেছিলাম। লাস্ট ক্লাসে আমরা রেডিওলজি দেখাইছি, এক্স-রে দেখাইছি, ভেরি ইম্পর্টেন্ট এক্স-রে ফর এক্সামিনেশন সেগুলো আমরা দেখাইছি। আজকে যেটা আমি দেখাবো ইনস্ট্রুমেন্টস, স্পেসিমেন এবং কিছু ট্রেসিং। There are many instruments, কিন্তু আমাদের পরীক্ষার সময় যেগুলো আমরা কমনলি যে ইনস্ট্রুমেন্টগুলো দিই বা স্পেসিমেন দিই সেগুলো আলাদা করবো। It's a huge chapter, কিন্তু আমাদের পরীক্ষার জন্য যেটুকু দরকার I will discuss only that. Let us start with today's discussion about instruments, specimen and tracing. So look at this. এইভাবে পরীক্ষা থাকবে তোমাদের। This is very important instruments এবং এই টপিকসটা তোমাদের জন্য খুবই essential for your OSPE, for oral examination এবং short essay question paper about tracheostomy. আমার পরীক্ষার সময় এটা একটা hot topics for examination of MBBS as well as postgraduate examination. যে tracheostomy বলতে আমরা কি বুঝাই? What do you mean by tracheostomy? Indication of tracheostomy, aims of tracheostomy, complication of tracheostomy. ওই রিলেশনে যে এমসিকিউ গুলা অথবা OSPE গুলো আসে সেগুলো I will show you today. So look at the questions. Identify the instrument, in what procedure this is used. So this is a cupped tracheostomy tube. এই ইনস্ট্রুমেন্টের নাম হচ্ছে cupped because এখানে দেখো একটা বেলুন আছে, বেলুন কাপ আছে। The tracheostomy tube different types হয়. This is cupped tracheostomy tube. We have non-cupped tracheostomy tube. This is plastic or Protex-made tracheostomy tube. We have also metallic tube. So, যদি এক কথায় বলো, this is the identification of the instrument. So, this is a cupped tracheostomy tube. It's made of Protex or plastic or PVC. যেটাই বলো না কেন। In what procedure this is used? So, we use this tracheostomy tube only one procedure, that is tracheostomy. So it is used in tracheostomy procedure, tracheostomy operation. Next question, mention 4 indications of this procedure. That means you have to write down indication of tracheostomy. So what are the common indication of tracheostomy? If you just think of the aims of tracheostomy, why we do this tracheostomy? So প্রথমে এটা নিয়ে একটু আলোচনা করি because there is very important topics for exam. প্রথমে what is tracheostomy? So tracheostomy is defined as an operation to make an incision over the anterior wall of the trachea and converting this incision into a stoma onto the skin surface. So this is tracheostomy. Or you can write very simple, or you can say this is artificially made a fistula. We are making this fistula between anterior wall of the trachea and the skin. So this is a classical, very, logical definition of tracheostomy. You can say this is artificially made fistula between the anterior wall of the trachea and the skin. As you know, the fistula is different as a communication between the two epithelial surface. So one is tracheal epithelial surface, and other is skin. That is tracheostomy. Or it's an operation to make an incision on the anterior wall of the trachea and converting this incision into a stoma onto the skin surface. Now, indication of the aims of tracheostomy, first thing is to bypass upper airway obstruction. In case of carcinoma larynx, classically in our country, carcinoma larynx, laryngeal edema, road traffic accident, laryngeal diphtheria, acute epiglottitis, acute laryngotracheal bronchitis. So all this indication will do tracheostomy. Number 2, to assist ventilation. As you know, in case of long-term patients, those who need ventilatory support, like nowadays coronavirus, Guillain-Barré syndrome, any other viral infection, patient has got respiratory failure, so we need tracheostomy. Especially the patient, those who need long-term intubation, now we convert this into a tracheostomy, especially all ICU patients. So classical indication of tracheostomy nowadays is to assist ventilation in respiratory failure patient or who needs ventilatory support in ICU. That is the classical indication. But in our country, we can say airway obstruction due to laryngeal cancer, carcinoma of the larynx. We can also do tracheostomy to reduce the anatomical dead space, for elective major head neck surgery as an elective procedure to protect the lower respiratory tract. These all are indications as well as aims. And in case of lung abscess or bronchiectasis, for cleaning of the tracheobronchial tree, that's called tracheobronchial toileting in case of lung abscess or empyema. So this is a common indication of tracheostomy. So in this discussion, you'll write down this indication of tracheostomy. You can put indication as a obstructive, as a supportive, all this. Now, mention 4 important post-operative complications of the procedure you have mentioned. That means complication of tracheostomy. Now, as you know, when you do the tracheostomy, there are some common complications like hemorrhage, because lots of blood vessels all around the trachea, thyroid bed, isthmus, so you can injure the thyroid as well. So there is lots of blood vessels. So primary hemorrhage, you can do reactional hemorrhage or hematoma. So bleeding or hemorrhage, primary hemorrhage or reactional hemorrhage. Number 2, if you close the tracheostomy stoma very tightly, the air can interrupt under the subcutaneous tissue and leading to emphysema. It's called surgical emphysema. A very important complication of tracheostomy is surgical emphysema. Don't forget that. Okay. Then you can injure the esophagus here. You can injure the parathyroid gland. You can injure the recurrent laryngeal nerve. Okay. You can injure the esophagus is there. So all these are the you can injure all these. So these are the common complication of tracheostomy: primary hemorrhage, reactional hemorrhage, surgical emphysema, or injury to esophagus, injury to recurrent laryngeal nerve. Now, name other alternative procedures that can be performed to overcome the same clinical condition. That means, is there any other way to bypass the upper ear obstruction, or you can protect the respiratory tract rather than tracheostomy? Yes, we have 2 procedures. One is intubation. The answer is because many of the patients nowadays, we try intubation rather than tracheostomy. So intubation is nasotracheal intubation, or intubation is one procedure. Another procedure, you can puncture the trichothyroid membrane. It's called mini tracheostomy or trichothyroidotomy. Okay. This is the other procedure, but intubation is important procedure. So this is all about tracheostomy. So this is another specimen of tracheostomy. Now, name the instrument. So this is a non-cuffed plastic tracheostomy tube. Look at this. This is a single tube without any cuff. Previously, it was cuffed with balloon. What is the use of this cuff actually? The cuff, there is important question in the exam. Why you use cuffed tube? Now, the reason of using cuffed tube is when you inflate the balloon here, that retain the tracheostomy tube so that it cannot cough out. When the patient gives serious cough, it can come out. So do the balloon, it will retain in the normal position. So it will not come out. One important use of balloon. Number 2, as we give the balloon, so it also reduce the, you keep up some pressure, it reduce the hematoma, as well as it reduce the leakage, so that any blood or any secretion cannot go down to the lower respiratory tract, causing aspiration. That's why this is an important cuff to hold that tube and to prevent lowering down all this drainage or secretion. Okay. Now, this is a non-cuffed plastic tracheostomy tube. Mention the user same. It is used in tracheostomy operation. Indication of tracheostomy to bypass the upper air obstruction, as I said, in case of carcinoma larynx, in case of acute epiglottitis, in case of laryngeal diphtheria, road traffic accident, in ventilatory failure patient, Guillain-Barré syndrome, respiratory failure patient, other viral infection. We can use this one. To protect the lower respiratory in major head neck surgery, you can use this one for tracheobronchial quality. Now, name 5 complications, the same we discussed. Complication of tracheostomy. Don't forget surgical emphysema. Don't forget surgical emphysema is an important complication of tracheostomy. And injury to the esophagus, laryngeal nerve, blood vessels injury causing hemorrhage. This is another instrument. Again, tracheostomy tube. Is this plastic or cups? No. This is metallic. So identify the instrument. So this is a metallic tracheostomy tube. Metallic tracheostomy tube. It has got actually, if I say what are the parts of this tube, so this is the tube actually. It has got flange, it has got outer tube and inner tube. Usually metallic has got 2 outer and inner tube, but here it's, I think it's inner tube is not seen here. But anyway, this is a metallic tracheostomy tube. In what procedure it is used? In tracheostomy operation. Indication, complication, same. So we have seen different types of tracheostomy tube we can give in the exam. One is cupped, plastic tracheostomy tube, non-cupped, plastic tracheostomy tube, we can give metallic tracheostomy tube. Now, we can give the patient with tracheostomy. Same way. So, what type of patient it is? So, this is a patient having or who had tracheostomy done, and the tracheostomy tube is in situ. So, this is a tracheostomized patient, or you can say this is the patient who had tracheostomy procedure or tracheostomy done, and the patient has a tracheostomy tube in situ. What type of tracheostomy tube? It is now is used a plastic tracheostomy tube. I think, I don't know if it's cup or not, it's not clear. So you see in clear view, it's cup or non-cup tracheostomy tube. Why such operation was done? Because done to bypass the upper airway obstruction in case of carcinoma larynx, or acute epiglottitis, or laryngeal diphtheria, or any other condition, rotary accident with laryngeal edema. Mention 2 immediate postoperative complications. The 2 immediate postoperative complications, number 1 is hemorrhage, bleeding, and number 2 is surgical emphysema. Surgical emphysema. So that is all about tracheostomy. Another patient with tracheostomy. What the picture shows? The picture shows one patient who had tracheostomy done, and the tracheostomy, plastic tracheostomy tube is in situ with the dressing. Name 2 possible common indication of tracheostomy: to bypass the upper air obstruction, especially in case of carcinoma larynx, laryngeal diphtheria, or patient to protect the lower respiratory in major head neck surgery. Name 4 complications of this procedure we have discussed. Mention type of tracheostomy tube. What are the different types of tracheostomy tube? So tracheostomy tubes are different types. One is plastic tubes, another is metallic tubes. Plastic tubes or PVC tube, protection tube, they have cupped and non-cupped, and metallic tube. So these are the types of tracheostomy tube. Now, other questions of tracheostomy, how to manage tracheostomy patient. So this is a question for oral examination as well as for written paper. Care of the wound, care of the patient, and care of the tube in 3 headings: care of the patient, care of the wound, care of the tube. As you know, after tracheostomy, patient unable to speak, so we can supply a piece of paper with some pen. Patient cannot call the people, so we can have supply the calling bell to draw the attention. Patient have sometimes unable to eat and drink, so sometimes we can put NG tube. Okay, we usually keep the patient in a proper position. We look into the tube. The tube actually not. You can see the either tube is blocked or not. If you have a cuff, we can sometimes deflate the cuff. If the metallic tube, we can change the tube. We can also look at the wound actually. So all this is about management of tracheostomy. So that is all about this. This is a very common instrument given in the exam, and you know how to hold this pudicum nasal speculum. This is your common instruments. We usually ask how to hold this one in your OSCE examination. So you have to hold this one. This is called, mention the name of the instrument is a pudicum nasal speculum. TACUDICUM'. Pudicum nasal speculum. Mention for diagnostic and mention for therapeutic uses. So diagnostic, this means to examine the patient nose actually to see what is there. So diagnostic is meant to see the nasal cavity, about the septal deviation, to see the turbinate hypertrophy, to see is there any bleeding points in case of epistaxis, or to see is there any other things like your nasal mass, nasal polyps, septal deviation, turbinate hypertrophy, any foreign body in the nose. So just you write anything you want. Diagnostic means to see is there anything wrong in the nasal cavity, to see the turbinate hypertrophy, to see septal deviation, to see nasal polyps, to see any nasal mass, to see any bleeding point in case of epistaxis, to see is there any foreign body or not. So this is a diagnostic. Therapeutic means the same way. Therapeutic means during the inferior anoscopic examination for nasal packing in case of epistaxis, number one. Number two, cauterize the bleeding point in case of epistaxis. Number three, you can do this in case of intranasal polyfectomy operation. Number four, you can do this, use this one in case of antral washout. Antral washout. So these are the four therapeutic uses of this instrument. Okay. Remember that. To see anything wrong in the nasal cavity, and therapeutic means to do some procedure. To do some procedure in the nose, like cauterization of the bleeding point, nasal packing in case of, as I said, antral washout, okay, to take the foreign body from the nose, okay. During other nasal procedure like during septoplasty operation, intranasal polyfectomy operation, antral washout operation, removal of foreign body, cauterization of the nose. Okay. What is the contraindication of using this? When we don't use this one, only one contraindication, important contraindication is if the patient has got a pharynculosis in the vestibule or L of the nose. Pharynculosis, very painful condition, we cannot use this one. Or vestibulitis, pharynculosis or vestibulitis, we can't use this one. So this is the contraindication. So this is all about pudicum nasal speculum. The most important procedure done by this instrument is anterior rhinoscopy. Anterior rhinoscopy. This is another very common instrument given in the exam. You know actually what is this? This one. So this is actually, name the instrument with different parts. This is a question. So the question is, name the instrument. So this is Boyle, B-O-Y-L-E, Boyle, D-A-V-I-S. Boyle Davis mouth gag with tongue blades. This is blade. So Boyle Davis mouth gag with tongue blades. This is different parts, actually the tongue blades are part, and this is the part actually which has got a jaw retractor here to retract the upper jaw from the tongue, and this tongue blade to push the tongue from, to push the tongue enterally to open the mouth actually, and it fixes with the lower jaw. So means this is a jaw part, this to retract the upper jaw, and this tongue blade actually to retract the lower jaw to make the mouth with wide opening for operation in the oropharynx or oral cavity. Okay, so these are the parts. Boyle Davis mouth gag with tongue blades. We have different sizes of tongue blades. Okay, so question was actually name the instrument parts. Now, how it is sterilized. Now, any surgical instrument, any metallic instrument, we have only two procedures for sterilization. One is autoclaving or autoclave, another is boiling. So there's only two procedures, autoclave and boiling. Mention two important uses of this instrument, or we can say mention some uses of this instrument, 2 or 3 or 4, doesn't matter. So we are doing this operation in case of tonsillectomy operation, classical one, tonsillectomy operation to open the mouth. Number 2, adenoidectomy operation. Number 3, operation in the palate, soft palate, or oropharynx, like your repair of cleft palate. We can use this one. Removal of any cyst from the hard palate, like palatal cyst. So repair of cleft palate, removal of any tumor from the palate, like pleomorphic adenoma from the palate, like any cyst, palatal cyst removal, or any other things in the palate, we can use this one. Any tonsillar growth, we can take a biopsy, or you can take the tonsil out in case of tonsillar growth, or any other lesion in the oropharynx, we can do this procedure. So classical indication of Boyle-Davis mouth gap is number 1, tonsillectomy operation. Number 2, adenoidectomy operation. Number 3, repair of cleft palate. Number 4, removal of any tumor from the palate, like removal of palatal cyst or removal of pleomorphic adenoma from the palate. In which situation this instrument cannot be used? Now, as we retract the tongue actually, enterally, so if there's any lesion there in the central part of the tongue or in the tongue, so any tongue lesion, any tongue tumor, any tongue cyst, we cannot do any operation in the tongue, number 1. Number 2, also sometimes throughout the mouth we can't do any operation, or if the patient has a severe TM joint dysfunction, this joint is very stiff, TM joint is very stiff, we cannot open the mouth. So we can use this instrument. Now, in this regard, we can ask other questions like, what are the common operation done by this instrument? So this is suppose tonsillectomy operation. Tell me some complication of the common operation. Then we have to write down all our tonsil. Complication of tonsillectomy operation. What are the different methods of tonsillectomy? So we'll come later. So these are the questions can be linked with this instrument, okay? Now, this is a classical instrument we can give in the exam. As you know, this is called tonsil holding forceps. So this is, we have 2 blades. It's called tonsil holding forceps. These 2 blades are very blunt actually, not sharp. So that's why this is tonsil holding forceps. But in case of sharp blade, it is lax forceps. We'll show later. Okay, so name the instrument. This is tonsil holding forceps. Now, mention 4 uses of this instrument. Now, use of this instrument means what are the procedure we can use this instrument. Classical one is to hold the tonsil in tonsillectomy operation. So we are using in tonsillectomy operation, number 1. Number 2, we can use this one in case of removal of enteroconal polyp to push the polyp towards the nasopharynx and take it out. So removal of enteroconal polyp, number 2. Number 3, what are the other uses of tonsil holding forceps? Anything you can hold this on, like during other procedures, we can use this tonsil holding forceps. But classically, we usually use this in tonsillectomy operation. We can use this enteroconal polyp operation. Okay, these are the 2. We can use it in case of removal of the or hold the nasopharyngeal angiofibroma. We can hold this one to push this one during the surgery of nasopharyngeal angiofibroma, or any other tough mass from the oral cavity, oropharynx, or nasal cavity. We can hold this one. and we can do the operation. Now, mention 4 complications of any operation done by this instrument. That means we are trying to say tonsillectomy operation, because this is designed for tonsil operation. Okay. So, what are the complications of tonsillectomy operation? And they said mention 4 complications. So, as you know, the tonsillectomy operation complication, most important is the reactionary hemorrhage. If I say only one complication of tonsillectomy, that is reactionary hemorrhage. Reactionary hemorrhage, you can also give primary hemorrhage, reactionary hemorrhage, secondary hemorrhage. So one is reactionary hemorrhage, another is secondary hemorrhage, another is you can injure during the tongue blade with mouth gag. You can injure the teeth, you can injure the tongue, you can injure the soft palate, you can injure the palate with diathermy, because we are using diathermy during hemostasis, or during the procedure the person may have anesthetic problem like your aspiration pneumonia or pneumonitis, chest infection. So these all are the common complications of tonsillectomy operation by the procedure, during the procedure in the while there is mouth gag or with the diathermy. Okay. How do you sterilize this instrument? As I said, only 2 methods of sterilization of metallic instruments. One is boiling, or other is autoclave. Look at this. If you compare the other one with this, so this is a very sharp blade, and one blade go inside the other. When you close the blade, this blade will go inside the other. But in case of tonsillectomy forceps, they'll come one after another. Not they are going inside. Okay. Name the instrument. So this is Lux forceps. Lux, L-U-C-apostrophe-S. Lux forceps. This Lux came from the French surgeon Henry Lux. Henry Lux and Caldwell. Okay, this Caldwell is an American surgeon. Henry Lux is a French otolaryngologist. From his name, it came Lux, L-U-C-apostrophe-S, Lux forceps. So name the instrument. This is Lux forceps, very common, classical. Mention 4 uses of this instrument. Number 1 is, as you know, this is a very sharp instrument. So we can use in different procedure. Number 1 is classically during polypectomy operation. So during intranasal polypectomy operation, to take the polyp out, hold the polyp and take it out. Number 1. Number 2, we can also use it as a holding forceps. Like I use tonsil holding forceps as a tonsil holding forceps in tonsillectomy operation to hold the tonsil. Sometimes the tonsil is very tough tonsil. When you hold with this your tonsil holding forceps, it can slip. But this is a very good grip. So I use this one. I never use tonsil holding forceps in my tonsillectomy operation. I use Lux forceps. So to hold the tonsil in tonsillectomy operation. So intranasal polypectomy, number 1 indication. Number 2 indication, tonsillectomy operation. Number 3 indication is your septoplasty operation to take the bony chips out. Okay, septoplasty operation. And number 4, we can use as a punch biopsy forceps. That means, suppose there is any growth in the tongue, any growth, ulcerated growth in the oral cavity, oropharynx, tongue. So you can just punch this one, grip this one, and take it out as a biopsy forceps. So to take a biopsy from the oral cavity, oropharynx, from the tonsillar bed, you can use this. So these are the common indication of Lux forceps. One is your intranasal polypectomy operation, number 1. Number 2, tonsillectomy operation. Number 3 is your septoplasty operation or SMR operation. Number 4, as I said, you can also use this in other procedure. Okay. So these are the as a punch biopsy forceps. These are the 4 indications. Now, how do you sterilize the instrument? Again, I said simple rule is a boiling or autoclave. This is another important instruments for your exam. Actually, these are all the specimen. I collected this from the examination bank actually. So this will be repeated every time. This will repeat. So these are the instruments you will get in your real exam. Okay. Now, identify the instrument in which operation it is used. So this is adenoid curate. CURATE, adenoid curate with case, CAGE, case, mane khacha. Case mane khacha. So this is adenoid curate with case. Now, what are the utilities of curate and case? Now, as you know, the adenoid is a blind procedure. It has got no capsule, so we cannot dissect adenoid, even we cannot see. So that's why it's not a capsulated organ. Adenoid has got no capsule like tonsil, so we cannot dissect adenoid. That's why we use this curate to curate the adenoid tissue. And once we are curating, or when we are curating, this case will engage or will collect or impact or collect the adenoid tissue inside the case so that it cannot slip down. Okay, that is the utility of case. And then after taking this one, you can just give a good thrust, the case will open and the adenoid tissue will drop down. Okay, so this is adenoid curate with case. Utility is we can curate the adenoid because it has got no capsule. We cannot dissect adenoid. We only curate the adenoid, and this case will collect the curated portion of the adenoid inside the case, and we can drop it later. Okay, so enumerate the 4 complications done by this instrument. Well, as you know, they said that this done by this instrument. That means, what are the common complications we can? One is we can injure the blood vessels, so hemorrhage, primary hemorrhage or reaction hemorrhage. Number 1, important complication. Number 2, we can injure the nasopharyngeal wall. We can injure the oropharyngeal wall. So nasopharyngeal wall, we can injure the hypopharyngeal wall. That means when you give a slap like that, thrust like that, we can injure the pharyngeal wall. So laceration of the pharyngeal mucosa, laceration of the nasopharyngeal mucosa, we can injure the nasopharyngeal mucosa. Number 2. Number 3, when you give a thrust laterally, there is a opening of the eustachian tube. So we can injure the opening of the eustachian tube, leading to tubal stenosis. And number 4, you can injure the atlantoaxial joint, or you can injure the cervical vertebra. So these are the complications of the instrument. Okay. Now mention 2 methods of sterilization of the instrument. So same method, we have option autoclave and we have option boil. This is another very important forceps. This is called Tillis, TIEEY apostrophe S, Tillis or Tilly. Okay, Tillis forceps, FRCEPS forceps, Tillis forceps, or you can say nasal dressing forceps. But usually the classical name is Tillis forceps. Very simple. It has a long blade actually. This is the holding part. These 2 blades. Now, identify the instrument. So this is a Tillis forceps or Tillis nasal dressing forceps. What are the methods of sterilization? Autoclave or boiling. Mention 4 common use of this instrument. Basically, this is for packing the nose actually, as I say. So during epistaxis, for giving or putting intranasal packing, intranasal pack, number 1. Number 2, to take any bony chips from the nasal cavity in case of septoplasty operation or SMR operation. Number 2. Number 3, or giving intranasal packing in any other nasal surgery like your face, like your septoplasty or like your SMR operation. Then we can also take some foreign body from the throat, like classical fish bone. We can take some foreign body, flat foreign body from the nose, like your plastic, like your foam. Okay, so these are the common indication of Tillis forceps. Number 1 is for nasal packing in case of epistaxis or in case of nasal surgery, like your SMR operation, septoplasty operation. There is nasal dressing forceps. We can put intranasal pack. Number 2, we can take any bony chips from the nose in case of septoplasty or SMR operation. Number 3, we can take any foreign body from the throat. So classically fish bone from the throat, we can use this one. Or we can use any foreign body from the nose, like your flat foreign body, point, plastic, or any foam. Very easily you can take it out. Or even we can take a cotton wool from the pinna or from the ear. Okay. Now, common causes of epistaxis in 55-year-old men. Common causes of epistaxis in 55-year-old men. The classical one, as you know, the most of the causes of epistaxis are idiopathic. We don't know really, but here they say it about 55 years old man. So you can write hypertension, classical one, hypertension. Number two, the patient may take some drugs like oral anticoagulant, aspirin, warfarin, the drug-induced hypertension. Number two. Number three is your idiopathic. You can write down idiopathic, traumatic, anyone. But classical one is your hypertension. This is another forceps very commonly used in the exam. Name the instruments with part. Now, this is a metallic tongue depressor. Metallic tongue depressor. We have got two parts. One is holding part. Usually the narrow one part is usually hold, and the horizontal part, the vertical part we usually hold, and the horizontal wide part we usually depress the tongue. So this is two parts. One is a depressor part to depress the anterior third of the tongue, and holding part to hold the tongue, to hold this instrument. Okay, so two parts, and holding part and depressor part. Now, mention for diagnostic use and mention for therapeutic use. Diagnostic use, again, to see any lesion in the nasal oral cavity or oropharynx, like to examine the oral cavity oropharynx to see any lesion in the floor of the mouth, like your ranula, to see any ulcer in the tongue, to see any lesion in the cheek, to see anything in the oropharynx, like to diagnose tonsillitis, acute tonsillitis, to diagnose peritonsillar abscess, to diagnose chronic pharyngitis, to diagnose any lesion, any fishbone, or any foreign body in the throat. So these are all are the diagnostic use of this instrument, as well as this very important diagnostic use is nasal patency test. Hold this one in the nose and ask the patient to breathe in and out and to see the fog. So nasal patency test. These are the diagnostic use. Therapeutic use, as you know, to do some procedure from the throat, like to take any foreign body from the throat, like especially removal of foreign body from the throat, from the oral cavity, from the oropharynx. We can also use this one as a posterior endoscopic examination to see anything in the nasopharynx or to take anything from the nasopharynx. Okay, so we can use this one. Now, other therapeutic uses actually, in case of nasal surgery, we usually, after giving nasal pack, we usually check the nasopharynx by depressing with this tongue depressor, so that to see if there any blood is going down to the throat or any pack is hanging down. So all this, we can use this as a therapeutic uses. Now, how do you sterilize the instrument? Again, the same way, autoclave or boiling. Now look at this, how we do nasal patency test. This is another instrument very important for exam. This is a metallic oral speculum. Metallic oral, not oral, oral, A-U-R-A-L, oral, not oral. Oral means oral cavity, or oral means ear, okay? So metallic oral speculum, mentioned for diagnostic use and therapeutic use. Diagnostic means, again, to see, actually we cannot see the external auditory canal, the outer part, that means the cartilaginous part with this, because we engage this instrument on that part. Okay, so we usually see the deeper part. So diagnostic use means to see the eardrum, to see any sorry, to see any perforation of the eardrum, to see any discharge in the middle ear, to see is there any polyp in the middle ear, to see any growth in the middle ear, to see any cholesteatoma in the attic, okay, or to see any foreign body in the ear, especially the deeper part of the ear canal or in the over the eardrum, to see color of the eardrum. Okay, so all these are the diagnostics. That means to see what's wrong in the deeper part of the external aortic canal, to see what's wrong in the eardrum, to see what's wrong if there's any perforation, what's wrong in the middle ear. So all this is just you can make it out, right? To see that these things, okay, to see the deeper part like any laceration, any foreign body, any granulation tissue, any polyp, any perforation of the eardrum, okay, any cholesteatoma. So all this is diagnostic use. Therapeutic use means what we do with this. Number one is actually to removal of foreign body from the ear, external ear. Number one. Number two, give oral toileting or suction. In case of oral discharge, we can clean the discharge with this. Number two. Number three, we can do some procedure like myringotomy and grommet insertion, or you can do myringoplasty operation. So these are the procedures. That means one is removal of foreign body, number one. Number two, oral toileting in case of oral discharge. Number three, myringotomy and grommet insertion. And number four, doing myringoplasty or tympanoplasty operation or stapedectomy operation or stapedotomy operation. So that is all about that. How to sterilize? Again, boiling or autoclave. This is, as you know, this is a mirror actually, very carved mirror. This is called PNS mirror. So name the instrument. This is a posterior rhinoscopic space mirror, or you can write down PNS mirror. Mention its uses. That only we use it in case of posterior rhinoscopic examination. So we use this one in case of posterior rhinoscopic examination or PNS examination. There is the only one use. Other use actually, with the guidance of this, we can take some foreign body from the posterior rhinoscope, from the PNS. If you don't have any laryngeal mirror, we can also use to have a look to the base of the tongue to see if there any foreign body. You can take it out under this guidance. These are actually vague actually, but only one use is posterior rhinoscopic examination to see the post-nasal space. What's wrong on that? Otherwise, you can also use this in case instead of laryngeal mirror to see any lesion in the tongue base or nasopharynx. You can take any foreign body under this guidance. Now, what precaution you will take during its uses? That means how you use this one. As you know, it's a mirror, so we have to hit with a spirit lamp and then toss in the back of the hand that is not too hot to burn your back of the hand, number one. Number two, it's not too hot to burn the patient's throat. These are precautions. And then gently depress the anterior third of the tongue with your tongue depressor. And you'll not push the tongue depressor the back of the tongue so that patient would have gag reflex. Okay, so these are precautions that you have to be very careful. First thing, warm the mirror and check with your hand and not too hot to burn patient's throat or your hand. Number two is depress the tongue on the anterior third to prevent gag reflex. So these are the precautions actually. Now mention the diagnostic purpose. Diagnostic purpose means with this mirror to see the nasopharynx, especially to see the adenoid, either is enlarged, to see anteroponal polyp. Number three, to see nasopharyngeal angiofibroma, juvenile nasopharyngeal angiofibroma, to see is there any foreign body in the nasopharynx or back of the nose, to see is there any growth in nasopharynx or fossa or progemolar, so that we can take a biopsy. So all these are the diagnostic uses of this instrument. Now, if we ask this question also here, what are the structures seen by this instrument? That means what you see in nasopharynx. Also, you have to know this one. So with this instrument, we can see the posterior part or posterior border of the nasal septum. We can see posterior part of the turbinates, infraturbinate, middle and supraturbinates. We can see the posterior choana or posterior aperture. We can in the roof, we can see the adenoid pad or adenoid. Laterally, we can see the opening of the eustachian tube, and more laterally, and tubal elevation, and more laterally, fossa of Rosenmoller. So these are the parts we can see by this instrument. One is posterior part of the septum, posterior part of the turbinates, posterior choana, opening of the eustachian tube, tubal elevation, and fossa of Rosenmoller. This is another mirror actually. It's called laryngeal mirror. So identify the instruments. Laryngeal mirror is straight. The PNS is curved, but it's straight. Okay. Mention the name of the procedure done by this instrument. Indirect laryngoscopic examination. So its name is indirect laryngoscopy, IL. What structure you can see with this instrument? We usually ask this question in the exam, in the oral exam. Draw and level a picture you can see with this laryngeal mirror. So you have to practice this one. You have to practice epiglottis, araepiglottic fold, through vocal cords, first vocal cord, tracheal link, base of the tongue, valleculi, and down is piriform fossa. So all the structures is written. You can practice this one. So these are structures seen by the instrument. Name 5 common. Name 5 common acquired causes of hoarseness of voice. You know, because I have no time now. You'll just know hoarseness of voice, vocal cord, any lesion in the vocal cord like acute laryngitis, vocal cord nodule, vocal cord polyp, vocal cord papilloma, carcinoma larynx, and vocal cord paralysis. This is very important for exam. It's a tuning fork. Now, what are the parts? Actually, this is a tuning fork, usually 512 frequency. These two are the prongs. This is the shoulder. This is the stem, and this is the base. So base, stem, shoulder, and 2 prongs. Now, what are the 3 tests performed by this instrument? It's a Rini test, Weber test, and absolute bone conduction test. Other tests like tilt test, Bing test. Okay. Mention 4 causes of sensory hearing loss. We'll discuss. I think I discussed. So these are the sensory hearing loss. 4 causes: classical presbyosis by autotoxic drugs, maternal torch infection, Meniere's disease, acoustic neuroma. Okay, all this. Investigation to confirm your diagnosis. Yes, Piotron audiogram. This is another instrument. This is a self-retaining hemostatic mastoid retractor. Another name is Mollison's. MOLLISON'. Mollison's self-retaining hemostatic mastoid retractor. Now, how causes hemostasis? Because it has a prong actually, so it retract the soft tissue and it gets stopped bleeding. Hemostatic. Okay, by retention of the tissue to stop bleeding. Now, 4 operations done by this instrument. As you know, this is a cortical mastectomy operation, modified radical mastectomy operation, radical mastoidectomy operation. Here is lateral rhinotomy operation or bar hole exploration. Complication done by this instrument. Mention 4 important complications of ear surgery done by this instrument. That means complication of mastoidectomy operation. Classical one is facial nerve injury, injury to dura mater, injury to sigmoid sinus, and medially we can injure the labyrinth, causing labyrinthitis and sensory neural hearing loss. So injury to labyrinth, medially, injury to dura mater, above, posteriorly injury to sigmoid sinus, and so these are the complications of mastoid surgery. And injury to labyrinth causing sensory neural hearing loss. This is antral washing trocar cannula. Nowadays, we are not giving this one because now doing endoscopic sinus surgery, but still you have instrument antral washing, Proper cannula for antral washout. Indication is chronic magnetic sinusitis. If it's not resolving, you can take a cytology from the magnetic sinus in case of cancer. These are the note given. Bromate. Now, this specimen, I have, I think, 3, 4, or 5 minutes more. Now, classical specimen. Okay, this is tonsillar operation specimen. Now, name the subduct specimen is a resected specimen of palatine tonsils. Okay, write down arterial supply. As you know, tonsillar blood supply, tonsillar branch of the facial artery, lingual branch of the external carotid artery, dorsal lingual branch of the lingual artery, ascending pharyngeal artery, descending palatine artery. Now, name the surgical options. Collecting surgical option is tonsillectomy operation, different methods of tonsillectomy, your dissection method, coblation method, bipolar diathermy, laser, ultrasonic scalpel. Complication of operation, as I mentioned, reaction hemorrhage, secondary hemorrhage, injury to palate, teeth, tongue. Okay. This is a specimen of adenotonsillectomy. This is the adenoid, and these are 2 tonsils. How the patient presents with, as you know, sleep apnea, snoring at night, nasal obstruction, mouth breathing, ear problem, all these. Name of operation, adenotonsillectomy operation. Methods, tonsillectomy methods I discussed. Adenoidectomy method by curate or by coblation. Complication of this we discussed. This is another specimen of tonsil and adenoid. This is a thyroid cyst. The lesion is a cystic swelling in front of the neck at the level of the hyoid bone. So diagnosis, thyroid cyst. 2 different diagnoses is a thyroid swelling at isthmus, pretracheal lymph nodes. How to treat? Cyst trunk operation. Cyst trunk operation means excision of the cyst along with body of the hyoid bone and trunk core. This is a tracing, tracing A and tracing B. So this is Pearson audiogram, and this is an impedance audiogram. Pearson audiogram showing a bone conduction around 20 decibel, but slightly dipping down of bone conduction at 2 kilohertz, and ear conduction is down about 40 or 50 decibel, and there is ear bone gap about 35 decibel. And this is a nose called Carhart's nose, and this is a AS graph. So this is a classical case of autosclerosis. Mention 2 important treatment options of autosclerosis, as you know. One is hearing aid, another is stabilectomy or stabiliectomy. 4 complication of surgical procedure of autosclerosis. That means stabiliectomy complication, as you know, we have tympanic membrane rupture or tear of the tympanic membrane. We can injure the chorda tympani nerve. We can injure the labyrinth or vestibule, causing sensory neural hearing loss. We can injure, we can have dead ear or erection of the incus. Another one is again the bone conduction around 20 decibel, ear conduction about 60 decibel, ear bone gap about 40 decibel. This conductive hearing loss, and this is a flat type B tympanogram. This is classical of otitis media with effusion. Number 2 is perforated eardrum, that means CSOM, and number 3 is a gross retracted TM. Surgical treatment of this procedure, maringotomy and insertion of bromate. Complication of bromate insertion, as you know, you can injure the eardrum, you can injure the ossicles, you can injure the jugular valve. This is a dumbbell-shaped specimen of resected polyps. So this is the whitish color polypoid lesion. It's a dumbbell in shape with constriction and 3 dilatation and 2 constriction. This is enteroconal polyp. Symptom signs we discussed about enteroconal polyp. As you know, the nasal obstruction, mouth breathing. Treatment option is your functional endoscopic sinus surgery or internal polypectomy in case of children, or Carl Dual-Luck operation in case of adult. But we usually do functional endoscopic sinus surgery. This is another classical picture of enteroconal polyp. This is the ethmoidal polyps. Look at the multiple polypoid lesion like a bunch of grapes. So all about ethmoidal polyps, how it comes, where it goes, treatment of polyp, bilateral conductive hearing loss. This is a resected specimen of thyroid one lobe with isthmus. So this is specimen of hemi thyroidectomy operation. Blood supply of thyroid, development of thyroid, complication of thyroid surgery, all right. Injury to the mostly hemorrhage, primary or reactionary hemorrhage, tension hematoma, injury to decanolaryngeal nerve, injury to supralaryngeal nerve, injury to parathyroid gland causing hypocalcific tetany, injury to esophagus, injury to trachea, and wound hematoma, and then wound keloid scar. This is a cyst lung operation. Look at thyroid cyst thyroid sinus. This is not given actually. This sensory hearing loss, both ear conduction, bone conduction down with minimal ear bone gap, bilateral sensory hearing loss, is a classical case of presbyosis. This is a resected specimen of thyroid, both lobes and isthmus. So this is a specimen of total thyroidectomy operation. Two indication of total thyroidectomy as a carcinoma of the thyroid, like papillary carcinoma thyroid, follicular carcinoma thyroid, multinodular goiter involving both lobes, complication of thyroid surgery I discussed. This is the patient with thyroid swelling, multiple multinodular goiter involving right lobe, left lobe, isthmus. So all questions about thyroid. I think this is a patient with left-sided facial palsy. Look at this; it cannot open the mouth, eyes. So for the clinical condition, a patient with left-sided facial palsy. Two surgical procedure during this causing this complication. One is your classical is your mastoidectomy operation. Another is a parotid surgery. Classical two operation: mastoidectomy operation and parotid surgery. What are the terminal branches of the facial nerve? As you know, zygomatic, temporal, cervicofacial, temporal, zygomatic, buccal, maxillomandibular, and cervical branches. Mention two problems of this condition. Two problems of the condition: the facial disfigurement, cannot close the eyes, so exposure keratitis, and dropping of the mouth. Sometimes when the patient eat and drink, the food can collect in the cheek. I think that's all about today's lectures. Thank you very much indeed. Actually, yes, I am in time. These are the most important instruments, specimen, and tracing for your exam. I think you will not get any of the specimen or tracing without this today's discussion. So these are the all exam-oriented specimen instruments. You will not need to read any other apart from this. That's all. Thank you very much indeed for listening. I think from next week, I will discuss first is oral examination. 1 day ear, 1 day nose, 1 day throat, and 1 day head and neck. So 4 classes of oral examination starting from the ear, nose, throat, and head and neck. Thank you very much.